Good day, everyone. Thank you for joining us at this Healthcare Executive Meetup. Now to begin, Kelvin Zhe, our Director of Public Sector Group at Microsoft, will give his opening remarks.
Good morning, everyone. This is Kelvin from Microsoft Hong Kong. And welcome to join our first virtual healthcare event in Microsoft Hong Kong. And thank you so much for your time today and your support with us. I believe most of you are working in the healthcare sector. So before I start, I would like to take the chance to say thank you. And thank you so much for supporting us in the past few months. And your effort in keeping Hong Kong continue to be one of the most safe and most healthiest place in the world. So for Microsoft Hong Kong locally, we launched a very meaningful campaign in early February. We call it the Empower Hong Kong campaign. And this campaign is meant to support different segments and different industries during the COVID-19 outbreak. So for the most affected area, like small and medium subsidiary, and also those students who cannot go to schools, we work with different partners and stakeholders to give extra services and extra licenses for them to empower them to use Microsoft Teams so that different staff can work from home securely, SMB could continue their business, and students can continue the remote learning with the school are closed. We are also working closely with different government departments like Lands Department to port the entire Hong Kong map onto our Azure as API services, such that other departments can use this map service to port those confirmed COVID-19 cases on the map instantly. In the past several months, we also see a huge demand on cloud resources to support different initiatives, like the online shopping and mass campaign from different retail groups. With our Azure and the power of cloud computing, we're able to handle over millions of concurrent access per minute. And this retailer could always easily deploy all sorts of new pop-up campaigns or new ideas within just days. Last but not least, we do see there's a traction of using telemedicine in different hospitals. And in one of our sessions later today, we have invited the CEO of CU Hong Kong Medical Center, Dr. Feng Hong Yiseng, and also UMP Healthcare Group, Ms. Mandy Ma, to share with us how they use Microsoft Teams to continue to engage their patients remotely and securely during the COVID-19. So that's my quick sharing regarding Empower Hong Kong. In case you have any questions for us, please do submit your questions through the Q&A box, and we will answer them online shortly. And without further ado, let me pass to Keren. And Dr. Keren right now is based in Singapore, and she is our Microsoft regional business lead in charge of our Microsoft business in Asia. And she will bring us some more update from corporate. Over to you, Keren.
Okay. So hi, everybody. I hope you're able to see my slides. So today basically would like to share two very interesting concepts. So before I begin, thank you so much for joining this meet. And I'll be going through two very interesting concepts. And if you don't mind, I'd like to just switch off my video for some time while I'm presenting and then be back with you as well. Okay, so if you can still hear me. This is Keren, and I'm the regional business lead for healthcare at Microsoft. And what I'm going to share today is what we call as return to work. Some of you would have seen this app that we have developed with United Healthcare. United Healthcare Group is basically a group in the US which offers a broad spectrum of products and services through two of their very distinct platforms. One is the in healthcare coverage and benefits, and the other is called Optum. So Microsoft had actually launched a return to work app with them, and we are discussing something similar with Walmart, and I wanted to share that with you. So with Walmart, what we discussed is how do you get employees back to work after the COVID period, but still keep the premise safe. So we developed something as a very interesting bot, and I'd like to share with you this example. So screening happens daily, and let's say if the individual has no symptoms, it could be an employee, it could be a hospital worker, or anybody in a big facility. So if there are no symptoms, then what happens is automatically you get the freedom automated admission into the facility. But what if, let's say, there is a high risk of having symptoms? Either you do have symptoms or there is a high possibility that the person is a carrier or is having initial symptoms. In that case, what happens is that a virtual visit is triaged, and then there's testing done, and finally you are sent to either the healthcare facility for further checkup and treatment accordingly. So the experience can be made very seamless by simply having a daily access with no login, which basically means that you don't have to log in every day, but you can use a unified access mechanism. And so it could be through your mobile, you might want to use it through your tablet or through your web, and it's secure and compliant. So it's as per HIPAA and GDPR norms. And then it can be authenticated either for a full-time or even a contract staff. So what happens is that using a simple bot, you can actually get cleared for work. So you can see over here, there's a Walmart return to work bot. And once the employee agrees to the terms and conditions, there's a certain set of questions, like a triage, which asks them, hey, do you have these symptoms? Do you feel sick? And so on and so forth. So if, let's say, the employee says no to all of that, what then happens is that the person is automatically cleared, and you get like a little QR code which the employee can actually scan and return or enter the premise. But what happens if, let's say, the symptoms turn positive? So based on the triage from the health bot, it seems that the person is either already infected or has symptoms of COVID. In that case, there's an alert that's generated, and the person is automatically triaged into a virtual consult. Now, in a virtual consult, a nurse or a doctor can actually ask more questions, and accordingly, whether the person has to be taken to the hospital or whether the person needs to be tested further, the next steps follow. So if you can see over here, this is a discussion on the virtual consult. The doctor actually talks to the employee and sees whether what needs to be done. And you can also activate a local lab so that a test is actually delivered to the employee. And what happens is that simultaneously HR is also informed that this particular employee has screened positive and therefore will not be cleared for work entrance till the hospital clears the employee. So it's like an automated flow where not only is the test and the hospital alerted, but you can also let your company know, the HR in your company, that, hey, this individual is not going to be coming for work for the next 14 days or so. And then what you can also do is that you can also, based on all this information that's being collected, you can also create a very beautiful dashboard based on the temperature screening, the contact tracing, and so on. So typically now you do see that in most hospitals and in offices, you do have thermal cameras, you have temperature screening, and so on. So using a simple Azure IoT integration, you can actually download all that information and be able to, using Power Apps, you can actually or Power BI, you can create a simple dashboard where the company officials can actually take a look and see, hey, which of my stores or which of my hospitals, for example, have higher number of cases. This can be done, you can drill down, you might want to see it within a facility or you might want to see across facilities. You can see how many of them have what kind of temperatures are being recorded and where are the areas where the cases seem to be on the higher. So this is, in a nutshell, a very simple way to actually return to work so that you don't have to have the hassle of screening each and every individual, but this can be simply automated by a single sign-on and then by being automatically tested and screened as well. So this is something that we've already landed with the United Health Group in the US. And we're also in discussions with Walmart, as you can see, and other larger facilities to enable easier return to work. So this is the first thing that I wanted to share. And the second very interesting news that I wanted to share with you is on the Microsoft Cloud for Healthcare. As you know, on the 19th of May, Microsoft actually launched the Healthcare Cloud. And this is the first industry vertical cloud that has been launched. Currently, it is under public preview, and then come October, it would be available to the clients as well. So just to give you a nutshell, Microsoft Cloud for Healthcare, basically it extends capabilities to drive automation and efficiency on very high value workflows, as well as, to drive deep data analysis for insights. So basically it helps support accelerated health transformation into the future. And basically it rests on three key pillars. You can see on the left, it's on enhancing patient engagement, empowering health team collaboration, and improving clinical and operational data insight. Now, what exactly is enhanced patient engagement? Enhanced patient engagement is really about having a complete view of your patients and creating very individualized patient experiences. And later, just after a few minutes, I'd like to share with you a demo on how that has been actionable on the Microsoft Healthcare Cloud. The second one is empowering health team collaboration. I think this became very evident in the current COVID situation. And empowering your health team to collaborate is to basically make it faster, easier, and more secure to coordinate care and collaborate across specialists, basically to generate that 360-degree view of patients across your entire patient care continuum. And last but not the least, hospitals can actually unlock very powerful insights with limitless analytics on the healthcare cloud. And these can then translate into very concrete business decisions that you can make and actions that unlock and help support very improved patient care, quality assurance, and great operational performance. So basically, these three pillars have been built on a trusted platform, which is unmatched with security and privacy. So in a nutshell, what becomes paramount is that you have a connected view of patients, you have connected care teams, and you have continuous patient monitoring. So these are the three outcomes of having a continuous healthcare cloud across all verticals. So in summary, what I can say is that Microsoft Cloud is just really about providing that integrated and trusted healthcare cloud capabilities to help all hospitals and providers deliver better experiences, better insights, and better care. And if you can see on this slide, you can actually see that on that unified healthcare cloud, we would be building engineering configurations which are specific to healthcare. Based on all the data that's been created or collected through your care coordination, through Office 365, through Dynamics 365, what we can do is to build common data models that actually use that data to create insights. And finally, using Power BI and also using Power Apps, we can create very customized applications that are required for your hospital. And last but not the least, it is also to enhance a lot of partner solutions built on this healthcare cloud, which can actually address many of the needs that hospitals have. So in short, these are the interesting capabilities that are going to be built on top of the Microsoft Cloud for Healthcare. So as I shared with you earlier, the three pillars. So I'd like to kind of end my presentation here and share with you a video on how using Microsoft Healthcare Cloud, you can actually enhance your patient engagement. So please share the video.
In this demo, you will see from 1 through 3, the patient is at home, coordinating care with the healthcare provider. At 4, she's at the triage station with the triage nurse. At 5, she's at the examination room at the hospital. And at 6, she's back at home after recovery. Now let's go through the demo to see what actually happens. The patient Cheryl needs to connect with the healthcare provider as she's having some respiratory issues. She logs on to Van Arstel's patient portal and clicks on Discuss Your Health. This then fires a health bot that can easily be configured into Power Apps and any existing portal. She notices that there's a personalized message for her. Welcome to Van Arstel Health, Cheryl. How can I help you today? I'm not feeling very good and have a slight fever. How long has this been going on? Just a few days. Any other symptoms? Yes, I've got some swelling in my left leg. Pic is attached. And you'll notice that there's a picture icon here. While asking for her symptoms, the bot is following a preset screening protocol to assess the severity of Cheryl's condition to the omni-channel for customer service view for call center agents to track any alerts coming in from the health bot. And you'll notice on the right that there is an alert coming in from the health bot. The agent reviews the details. Chat request from Cheryl Bryan. Comment, escalation for bot. The agent accepts. He also notices down below that there's a preset script to follow, including one for escalating to telehealth. He also notices there's a smart assist using AI that's providing a recommendation on next best action. In this case, it is to escalate to telehealth. To do that, the call center agent decides to enter the conversation. And you'll notice that there is a conversation that populates. John, who's the agent. Cheryl, this is John, a call center agent. We should have you talk to a telehealth nurse. When are you available? Anytime today. We can get you a telecall at 9 a.m. Is this your email address still? Yes, thank you. The agent finishes the chat as a live interaction with Cheryl, recommends a telehealth visit, sets the appointment. Now let's take a look at what Cheryl's view is. Cheryl sees the same information that John saw in his view. The magic behind all of this is the ability to screen large number of patients without human intervention, but then route the serious cases for human review. In parallel, Cheryl receives a personalized appointment with instructions on how to join a telehealth appointment with an acute care nurse. When the appointment time arrives, Cheryl joins the call. The nurse looks up Cheryl's detail in the Customer Insights Healthcare app. She notices all the different patients and then finds Cheryl and then clicks on her details to see the summary. Cheryl is 30 years old, and she also notices that there's a health bot chat transcripts about shortness of breath and a telehealth consultation between a nurse and Cheryl and her referral to acute care. The nurse immediately moves Cheryl to an acute care room for the PA to examine her. The PA who's responsible for triage comes by and looks at Cheryl's details in a third-party solution, Allscripts. Partners like Allscripts form the backbone of the treatment experience and are the central home for the patient care data. Other systems, such as the Triage Nurse Insight app or the omni-channel system, can feed the EMR through a common data model and fire. The PA examines Cheryl, runs a few tests, and realizes that she might have early onset of COPD and begins a treatment that will help her control this chronic condition. The bot reaches out to Cheryl a few weeks later via text to check on her prescription and how that's working out. She clicks on the text that opens up the chatbot. Let's go ahead and look at the conversation. Welcome back, Cheryl. I see you're responding to my text check-in. How are you doing today? I'm breathing much better, but when I take my medicine from my inhaler, I get slightly nauseous. It's minor, but annoying. Okay, let me set up a quick consult with your doctor in the next few days, and we'll see what we can do about that. That's perfect. I'm pretty open all this week and also next week. Dr. Carl is open this Friday at 2 p.m. and Monday at 11 a.m. and 1:30 p.m. I'll take the last one on Monday. Done. You should get both the email invite and a text message to see Dr. Carl on Monday at 1:30 p.m. With this, Cheryl's COPD is well managed and she experienced a personalized, relevant, and high-quality care engagement from the beginning to end.
Next, please welcome Tony Lam, Deputy Privacy Commissioner for Personal Data.
Hi, good morning, everyone. I'm Tony Lam, the Deputy Privacy Commissioner for Personal Data. I hope you could hear me clearly.
Yes, we can, Tony.
Okay, So I will start now. First of all, very great to have this event today, and thanks Microsoft for hosting it. And very glad to see you all virtually. And I think when all of us are working online, we have to adjust a little bit of our modus operandi. For instance, for me, I have to personally adjust my psychology in the sense that I have to feel that you are around me in order for me to share what I have today with you. Anyway, perhaps we learn much more about the importance of life, health, and love in the past 5 months, more than any 5-month period in our lifetime. We fight the virus, we fight for health, and in this process, we all learn something new. Medical and healthcare professionals being no exception. Physical medical consultation has to move online because of the pandemic. And all of a sudden, I think we all realize that what we have probably not thought of previously or seriously, or what we have not been making great progress, have all of a sudden become what may become a new norm, telemedicine. So how should we manage this digital transformation from offline to online, and what journey are we going to take, and how we are going to make this journey accountable to our stakeholders? That is what I would like to share with you this morning. Locally, some public hospitals have already adopted telemedicine measures, and as we understand, it is more for general consultation, but we will hear more from the experts in the later part of this panel. And let me share with you some of the statistics we have come across in other countries. In the UK, according to the UK Royal College of General Practitioners, in the 4 weeks leading up to the 12th of April, about 71% of routine consultations were done remote, compared to 25% in the same period last year. So the demand for telemedicine surged dramatically during that 1 month period. And in the US, the demand for telemedicine is projected to increase by almost 2/3. And I think the surge for demand for telemedicine is very obvious, just in one single phrase, as said by one general practitioner in London. We are basically witnessing 10 years of change in one single week. So telemedicine, as consultation is conducted online, our i.e. over video conferencing facilities, we advise the following for protecting personal data privacy. Our advice includes using the most updated version of the software so as to ensure that the latest security features are included, ensure using end-to-end encryption, using strong password for your consultation meeting, give the password only to the patients and the doctors involved, use only one-time password, do not repeat it, and do not videotape unless absolutely necessary and with the consent of the patient, etc. You have to ask yourself as well, are you ICT ready? In the final analysis, you do not want to cause a harm or surprise not only to the patient but to the healthcare providers themselves. And what if we engage a cloud service provider? You certainly need a secure cloud environment. So what should we look for when we choose a provider? Try to obtain sufficient assurance from the vendor on technical and organizational data protection measures, because only with technical and organizational measures could you be given confidence or assurance that they do have some tools to protect your data. For instance, whether or not the cloud service provider have obtained data protection and IT security certifications, for example, ISO 27001 or ISO 27701. These numbers are always very confusing, but 27001 has been there for quite some time. It's on IT security management system, but ISO 27701 was rather new. It was promulgated by ISO last year in August. and which blends requirements for IT security management with personal data piracy. And the ISO hailed this as the world's first certification standard requiring both IT security management and personal identifiable information protection. And you may also want to look for whether or not the cloud service provider have other accountability practices, like whether or not they have data protection officers, whether or not they have robust piracy policies and procedures, whether or not they conduct regular piracy impact assessment, etc., whether or not they allow third party to do auditing and assessment. And data users could also make reference to another ISO standard, which is pertinent to the cloud environment. That is ISO 27018. This was first published in 2014, and it is meant to supplement ISO 27702 with additional access controls that are more specific to personal data piracy in the environment of cloud. We have talked generally about how we may deal with the personal data piracy implications arising from the use of video conferencing for medical consultation and the use of apps for other incidental functions. For instance, purchasing medicine, making appointments with doctors, paying for the hospital bills. And there are other apps very widely used in the mainland by insurance company, for example, Ping An, and other companies like Alibaba, which provide these incidental services. And in Hong Kong, the hospital authority provides HA Go, which also provide automated functionalities like the booking of appointments in specialist clinics, etc. So the usual best practices for developing mobile apps would apply in order to manage telemedicine better from the personal data piracy angle, including data minimization, collect as little data as possible, purpose specification, and use limitation. At the end of the day, the rule of thumb would be piracy by design and by default, i.e., don't think about how you protect personal data only as an aftermath. After developing all those functional and engineering features, try to think about them upfront and onset together and in tandem with all those functional and engineering requirements. At the end of the day, transparency and explainability is the key to engender trust with your stakeholders. So we have talked about how we may deal with personal piracy implication arising from the use of video conferencing and other apps. I think that nothing would be complete this morning without mentioning how personal data piracy is implicated by COVID-19 pandemic. As you all probably know, the fundamental method to contain and tackle pandemic will inevitably involve testing, and if tested positive, you quarantine or isolate the persons concerned, and you try to trace those people who have close contacts with the infected patients, and you start the cycle of testing again, and with all these three steps, you try to contain the pandemic. The part on testing will involve and also tracing will involve important personal data piracy implication, depending on what technologies you may use. In Hong Kong, the health authorities make use of wristbands coupled with mobile apps to ensure all people under home quarantine do follow home quarantine orders. The wristbands have been designed without the use of GPS functionalities. Neither the wristband nor the app itself contain GPS data, and the app collects signals from the wristband and together with other signals like the Wi-Fi signals, 3G, 4G, Bluetooth in the environment, and they try to detect the changes in these signals in the environment to draw an inference whether or not you're staying at home or go outside home. So in a way, this differs from other countries. Some other countries use GPS data. Some other countries use telecom data. Some use credit card information to see where you have gone, and some use a combination of these parameters. Some combine it with facial recognition. In a way, what we use in Hong Kong is arguably less privacy intrusive. And the health authorities do promote transparency by an online dashboard that provides information on the list of buildings in which infected persons and confinees have resided and or visited. Some patient information, for example, age, gender, are also listed, but no precise information is provided to re-identify patients. For example, the names of the patients are not provided. The precise flats in which the patients live are not provided. And we have been asked very frequently by employers if they could disclose the names of infected employees or close contacts to the unaffected employees for the protection of the health of the wider circle. And we have also been bombarded by lots of questions from those building management companies as to why the government does not disclose the flats, the precise flat number in which the infected people live. How do we advise them? We provide a 4-stage test to the employers and to the building management people. Number one, you ask yourself what you are trying to do, whether or not it has a legitimate aim. Generally, there is a legitimate aim because they want to protect better their employees or protect better the people living in the same building. But the second question you have to ask yourself, whether or not what you are going to do is rationally connected with your aim. So you have to ask yourself whether or not disclosing the names of the individuals and disclosing the precise location which the infected people live do help protecting the wider public. Generally, the answer is negative. And the third question which you have to ask is whether or not what you are proposing to do is no more than is necessary in order to pursue your aim. And the fourth question, by disclosing these personal data, you will certainly affect adversely the privacy of the persons concerned. So the fourth question is whether or not encroaching the privacy rights of the people concerned is proportionate to the wider public interest of the community. We do not create the 4-stage test by ourselves. It is actually from our Court of Final Appeal in ruling on a case a few years ago. And these are 4-stage tests. There's a cardinal methodology when you have to do something which may encroach the privacy rights. And in all these cases, you could see that it is hardly justifiable that by knowing the names of the patients, you will fight the virus better. No way. And neither is it necessary to know the precise residence of the patients, because when you sanitize the affected areas, you sanitize probably the whole building instead of just sanitize the doorstep of that particular flat. So the virus does not operate in a way that they follow the named patients. No, they don't. They don't care about what you are called. And they don't have a zip code. They don't have an address. So in this way, we try to balance the privacy rights of the people concerned and the need to protect the public health. The episode does not end here. The whole world is fighting the piracy. And in the current pandemic, many countries are trying to turn to digital solutions for contact tracing. For instance, short distance within 2 meters, exchange of Bluetooth signals among smartphones to keep track of contact history, and close contact may be defined as that contact being lasting over 10 to 15 minutes or whatever. And these exposure notification apps theoretically allow public health officials to quickly notify the people who were in close contact with infected persons. And there is an ongoing debate as to whether or not a centralized or decentralized approach should be used. Different countries use different methods. It all depends on the cultural appetite for privacy and also the specific concern about the public interest in that locality. From a privacy angle, we advocate apps of this type should follow the principle by design. At the end of the day, we advocate voluntary participation. We should try to use anonymization and data minimization. Geolocation data are more sensitive, so try not to use geolocation data. And generally speaking, the centralized approach whereby data is being stored locally would be better in terms of protecting privacy, ensure that they have a necessary cryptographic encryption. So there is a big catch. Is technology anything? Mind you that the Bluetooth signal could pierce through glass. And so with the aforementioned definition of contact tracing, you may get false negative and you may get false positive as well. For instance, if you kiss your loved ones for over 1 minute of time, you have a higher chance to get infected with COVID-19, but you won't get exposure notification because the contact is less than 10 minutes. But if your neighbors open their Bluetooth devices, and even that, you may get exposure notification. So technology is not everything. And in this accountable digital transformation journey, technology helps, but it cannot replace human beings. So let me summarize what we have gone through so far in our journey. First, privacy right is not an absolute right. It may be subject to other competing rights or interests, such as the absolute right to life and the interests of the public, including public health interests. And privacy can be balanced against technological functionalities and societal benefit. So you have to choose the equilibrium point very carefully. At the end of the day, we as a data protection agency always position ourselves as both an enabler and a protector. We do not put philosophical stumbling block in the pursuit of the wider public interest. In overall terms, be transparent and explainable. Only through transparency and explainability could you be seen as accountable and ethical. And in this digital transformation journey, I think it would again be incomplete if we do not talk about artificial intelligence. AI is always hailed as something that guides us into our intelligent future. And I think a lot of you know better than I do the usefulness of AI in helping diagnosis, etc. So I won't repeat here. But I want to raise a point. Technology is not everything. Technology may mislead you if you are not careful enough. Take, for instance, a large academic hospital in US tried to use AI to analyze patients' data with a view to identify those patients needing extra care. So this is a very lofty aim, very good. And after a year, the hospital noticed that the health conditions of colored people deteriorated indeed faster than those of white people, although their initially assessed health risk levels were similar. So the hospital people tried to go through the algorithm and try to investigate what went wrong and why this happened. Then the investigation discovered that the algorithm had used the medical expenses incurred by patients as an indicator for healthcare need. So they used a wrong indicator for the algorithm, but the people in the hospital do not know, and they think AI is everything and AI could do the work. So let me try to fasten a little bit. At the end of the day, in the international community, we discuss a lot about how we can use AI ethically. We focus on the principle which you can see on the screen: fairness, continued attention, transparency, and intelligibility, etc. So we have to empower people instead of discriminate people. And some business consideration in order to make telemedicine successful, there are issues about insurance. For instance, there are arrangements whereby different reimbursement rate would be given for in-person consultation and telemedicine services. So that has to be changed if you have to make telemedicine a true option. And users habits, sometimes communication over online is more difficult and you cannot actually feel some of the symptoms of the patients. Practical limitation, whether or not you have the sufficient ICT capability. For the accountable digital transformation journey that has to be made successful, at the end of the day, treat humans as humans. Piracy is fundamental human right, but not absolute. And when we move more operation from offline to online, we have to look after a lot of the perspective from the E perspective. And let me end my presentation here. The Geneva Declaration is dated back in 1948, and it has its roots tracing to the Hippocratic Oath in ancient Greek. All medical graduates take this oath, and I won't recite the oath here, but I just extract a few lines. Here you can see on the screen talking about respect, autonomy, dignity, respect, and all that. And at the end of the day, healthcare and medical services are to preserve the human dignity and decency, just like piracy. Piracy is also to protect human dignity and decency. And if we want to move online, it is very important for we to think about all this with a prefix, E. What would it mean by E respect? E autonomy, E dignity, E human rights, and E threats. If you think in holistic way to provide telemedicine services to your patients, we will be there. Thank you very much. Thank you.
Thank you, Tony. Now, Dr. Hong Feng, CEO of CUHK Medical Center, will talk about telemedicine in Hong Kong.
Okay, good morning, everyone. Thanks for inviting me to this webinar to talk about telemedicine. I'll share a little bit of our experience of practicing telemedicine at the CUHK Medical Center, and then I'll talk very briefly about some of the challenges and issues that we face in telemedicine. Now, public need for telemedicine is enormous because it actually creates convenience. And in the old days, of course, there are limitations in terms of technology support and various other aspects. There are concerns over like privacy issues as well that has been discussed. But nowadays, technology actually has enabled us to actually go a much longer way in terms of supporting our patients, in terms of accessibility, in terms of convenience for their care. So it's not started now. It's actually started quite some years ago. And in fact, in Hospital Authority, we've been practicing telemedicine by linking with OH homes, for over a decade. But now, we can actually start to see telemedicine going to patients' home where they are located. And I think in COVID, in early 2020, it actually gave us the opportunity because of the lockdown, patients staying at home. So it actually the opportunity of actually providing virtual care online. Now, in 2 years ago in US, they've done a survey among the US by a group of US physicians, and then to look at the consumer and physicians, look at the different perspective, acceptability in terms of telemedicine or virtual care. It showed that in terms of consumers, from patients' perspective, there's actually a much wider acceptance than the physicians. Okay, in general, physicians are much more conservative in terms of how they could provide care. And there's actually a reason to that, while consumers see convenience in the process of care, but physicians, they do have a lot of concerns in terms of, whether they can make a right diagnosis, whether they can actually sort of prescribe the right treatment. And then, of course, the ethical issues as well. COVID-19 actually act as a catalyst, because of the lockdown situations, as I mentioned earlier on. Actually, it necessitates telemedicine, because patient can no longer come to the clinic. Patient prefer to find it much safer, or they are actually required to stay at home, right? So there is actually a lot of whole sort of a series of processes that would be actually conducive to, or that would be included in this within the so-called the scope of so-called telemedicine, like appointment scheduling, and the patient intake, starting a consultation, and also billing, and then prescription as well. So these are the normal sort of consultation process that is required, and all these actually can be done online. And in Hong Kong, like elsewhere in the world, a lot of the primary care providers at the present moment, or private hospitals, or even in public hospitals, we're starting to actually provide telemedicine, as a service to our patients. Okay, now. And of course, what we're seeing now is actually what we have at the present moment in terms of technology, and we can see that as we start with telemedicine now, the future capability of technology could actually give us much more options in terms of support healthcare. So in the healthcare literature at the present moment, it's actually a lot of publications and discussions on how, once telemedicine is started, on what we have now, can actually transform or also actually disrupt healthcare sort of in the longer run, in terms of course, cloud technology, AI applications, helping doctors to make decision making, and then providing care at home and all sorts of things. Now, it's actually maybe a coincidence. Hong Kong Medical Council did not predict that there's a pandemic coming, but in January this year, they actually issued an ethical guidelines on telemedicine. And this is important for the professionals in Hong Kong because it stipulates, what the important points in which healthcare professionals, especially doctors, have to actually take care when they try to provide care to the patients in a tele way, And that actually, these guidelines include some key points like, whether you conduct the consultation face-to-face or actually by telemedicine, the doctor ultimately is fully responsible. The standard of care has to be protected. It has to be the same. Privacy and security, it's actually very important aspect of all these ethical dimensions. And also the other thing, it's actually especially sensitive nowadays, is that there's actually a lot of, or there are actually increasing demand for sort of teleconsultation across the border as well. And we have to actually respect the appropriate licensing requirements, across jurisdiction. These are all important aspects in the ethical guidelines promulgated by Hong Kong Medical Council in January this year. Go back a little bit, look across the world. The HIPAA standard. There's also guidelines in terms of the expectation of compliance in telemedicine, and this actually emphasize on access to electronic protected health information and the secure communications. And as you can see, all the privacy and and security is actually very high up in the agenda, whether it is locally or internationally, in terms of the practical the practice of telemedicine. There are other related issues as well, like the infrastructure, technical capability, IT literacy of the not only the patients but also of the doctors. These cannot be taken for granted. Patients' expectations, what's come out from a telemedicine, whether it can actually replace face-to-face, and then other issues as well, like the social isolation, well-being of the doctor, the actual communication process, whether telemedicine itself is actually good enough to replace the face-to-face communication. So these are all important. But to the doctor, what is last but important is also compensated. The time actually is spent for communicating with the patients, but at the present moment, would they be able to be compensated in the similar way as the face-to-face consultation? That's another issue. Okay. Now, and we talk about the 6 C's, summarizing all these issues. There are all these 6 C's in terms of the practice of telemedicine, including competence, communication, contingency, confidentiality, consent, patient consent, and also confidence, both for the patient as well as for the doctor. So the 6 C's dimensions which are important when we try to set up the infrastructure, set up the guidelines, set up the practice in terms of telemedicine as well. So because of time, I will not go through this, but one by one. In US, because of the COVID, the Center for Medicare and Medicaid Services actually start to reimburse, and also private insurance as well, start to reimburse patients or doctor consultations, through telemedicine. And I think this is a very important step because to actually protect the financial interests of the doctors as well, because doctors have to actually survive on consultation fees as well, right? So we talk about a little bit about privacy, security, and drug dispensing sort of issue. Now, in terms of cyber risk, there are other areas which are important, like especially when we try to use medical device wearable, there are security concerns of all these, how to identify patients and the authentication issues, and then sort of the security monitoring and the and training awareness. These are all the focused sort of area. From our experience, it seems that just like the earlier speaker talked about, the encryption, end-to-end encryption is very important. That's actually one way to ensure security. We try to, and then when we do recording, it has to have patient consent. Actually, the whole process, the patient has to be engaged and understand what it can do in replacing face-to-face consultation, and what cannot be done. For example, physical examination, cannot be done. Try telemedicine, and if physical examination cannot be done, how can the doctor, the doctor, how can the doctor assure that he's got all the information that is necessary in order to actually make sure that this is an effective and really valid consultation? It's a very important aspect, right? So. And I think there are many questions in terms of user friendliness. Patients may not be IT savvy, and surprisingly, even doctors may not be IT savvy as well. And so many of the time, you need some institution support to doctors in order to actually ensure that telemedicine is a success. And that's why in the earlier slide I showed, most of the telemedicine practice at the present moment are being done by medical groups. Instead of individual doctors. And I hope, eventually, when there is actually a better platform that's available sort of on the cloud, so even to individual doctor, then telemedicine could actually sort of move much faster. Now, this is the last bit, which is a little bit more tricky in Hong Kong as well, and that is telepharmacy, whether we can actually deliver the drug to the patients. It's lockdown situation, patient cannot come to the clinic, they still require medication, but how can we deliver the patient to the medicine? Now, at the present moment, according to Hong Kong law, this is a quite big hurdle, because medication has to be delivered to the patient by professional, directly, so that and to make sure that the medication that's given to the patient is actually correct. Not only in terms of given to the correct patient, but also the right dose, right time, and right information, and that sort of thing. So this is actually still a bit of hurdle at the present moment. The hospital authority has started a pilot in which they engage community pharmacy to actually allow the patient to pick up the medication from the telepharmacy, you see, but the patient still have to leave home to pick up the medication from the telepharmacy. So legislation is actually back up in terms of the dispensing of drug is still a problem, something that we need to look into, provided, of course, it requires sort of IT support, technology support to ensure that all this, everything right is right. Okay, so because of time, I run through this slide very quickly. Hopefully, we'll help the organizers to catch up a little bit in terms of the time as well. So I would like to sort of answer questions later on. Thank you.
Next, we have Mandy, Deputy GM of UMP Medical Group, and Keith from Counterfire to share the story of their digital transformation journey.
Yes, there are quite a number of pain points that we healthcare service providers are experiencing. UMP has been thinking how to improve our patient experience to a more holistic level, starting from booking appointments, registration, all the way to drug dispensing, or even the post-consultation services. And then say, for example, we have to thinking how to shorten the waiting time for our patients in the clinics, how to let our patients to book appointments easier or more convenient, and then how to smoothen the checkup process so that they can feel they are cared. And indeed, there are different software or apps in the market to help. We have EHR, we have a document management system, we have CRM, or we have a ERP for drug dispensing, but they are not synchronized. Many often our clinical staff has to do manual work to link all of them together. So you can imagine the efficiency is undermined, and in turn affects our patient experience. So I'm very much hoping digitalization can help us out.
Okay, I think that as an enabler, digitalization enabler of the UMP group, actually we can share some more about our experience. Like for example, because we understand that for the UMP group, actually they have a couple of the variety of the medical service that you can provide. Yeah. Like for example, that you have the GP, you have the specialists, you have the beauty medical, and at the same time that you have the Chinese medicine as well. Yep. So that's I think that for the whole digitalization journey, when we are discussing with the UMP, the first thing that we have to do is actually we have to find a kind of the platform. That's probably is shared in the previous section from the Tony. That's we have to find a platform that is what we call is the privacy enable platform. So that's the reason why from day one that we pick up Microsoft as a kind of the platform. And at the same time, that's because you know that's for the previous, as what you mentioned about the EHR, document management system, and etc. Right now in the market is actually quite silo. Yeah. And then we have to find a kind of the platform that is more open. That is what we call is open architecture in more technical perspective. So that we can connect it. Like for example, right now the government is pushing some of the EHR connection with the government body and then the private medical center. And at the same time, that's because we are thinking about more about that on that as well. Because you know that's right now a lot of the what we call is the public portal or the public information provider that you can provide a lot of the medicines, like the pharmacy information, like how's the dosage, and also about the interaction or side effect of the medicine. So that's right now we are not only talking about the whole what we call is an internal perspective. Right. We would like to talk about in more details on the openness and also how we interconnected with the another external source to help the doctor to make the decision. Basically, what we have go through the journey with the UMP group actually is not only about the business process. At the same time that we have, as what the previous section, Dr. Fong mentioned that, because we understand that a lot of the doctor or the medical specialist is not the computer expert. So that's the reason why we have a lot of the, what we call is a lot of the minor UX designer or minor helping or for them to easier to use the whole system. Right. Maybe you can share some of your experience as well.
Yes, I think quite many of the doctors, or not even doctors, or nurse, they are not quite familiar with the technology, or they are they're not used to use some electronic records or something else. So we, of course, I every day have to communicate with the doctors to convince them how to use the systems, or how can the system help them. So this is very important. And I think between the discussions and meetings, we are very focused on how to get the system user-friendly to doctors. This is very important because quite often doctors also form their field. Once they use the system, if they think it is not user-friendly enough, they are quite resistant to use anymore. So it is very important. So detail is everything, I think.
Yeah, I think this is very good comment that this detail is editing. Actually, we have actually when we are doing this kind of the digitalization journey with the UMP, as what we mentioned, that we have tried to using a kind of the small portion, like for example, that's you know right now as a kind of the small medical center. Sometimes that the people resources is quite scarce, so that how we optimize some of the process. Like for example, that after the nurse to pick up all the medicine, and then how we can streamline the whole process. That how we can using the digital signature or the digital like for example the apps or something else to let the doctor know that they have to doing this kind of the next job and etc. And not only for that, so I think that's another goal or mission of our project with the UMP for the digitalization is what we are talking about, the patient journey as well.
Yeah.
Because before that, maybe you understand that every time when we got sick and then we go just to see the doctor, and then definitely, and then after we have take a couple of the medicines, couple time of medicine, and then we cure, and then this is the end of our journey. The another thing that we are talking about is we would like to take care more about or to adopt more about what we call is the family doctor concept. That is, we would like to make the whole what we call the patient journey is a kind of the treatment plan. That is not only for the long-term diseases, people or something else. We actually would like to become a kind of the more proactively alert to the patient. Like for example, if I'm going to take some of the antibiotics, and then we have to alert them, you have to take it on every day. And after you finish it up, you have to finish it up, and etc. etc. Maybe you can share some more about on how we are going together to doing that such.
CRM, right?
Yeah.
Yes, the CRM is quite important nowadays for the healthcare service providers, because I think quite for the expectation of patients is not just the few minutes or the few 10 minutes during the consultation time. They are very much hoping that we can provide more post-consultation service to them. Say, like you said, to remind them to have the medicine on time, or when they will have to do another checkups or other examination. It is quite important. So the other thing is we hope to use technology, and then of course human is the very important factors still in the healthcare industry, combined together to provide the real holistic experience to our patients.
Yeah. I think that's it for today, our section, because unfortunately the time is limited. Actually, we would like to share maybe a couple of days, but right now you can, we can leave all the questions at the end. So that's all for our section. Thank you very much.
Thank you.
Finally, we have Letty Sin, Business Group Lead of Dynamics 365, to share how COVID-19 is reshaping the industry.
Hi everyone. I hope that you have enjoyed the previous sections. It's a lot of local cases of how local medical centers and healthcare agencies have reformed due to the COVID-19 situation. I'm Letty, I'm the Dynamics Business Group Lead, and today I want to just go through a couple of the recap of how globally we're seeing how Microsoft is helping other agencies around the world to reform. I believe that the COVID-19 has indeed changed a lot of the way that we work within healthcare organizations, and how patients are expecting their services are changing. So today I'm just going to quickly go through how global healthcare institutes are using emergency response and remote assist tools for their services. So let's jump quickly into the cases. So we know that in the US there's still a lot of incidents of where the COVID-19 is being curbed. You know heard a lot from the news that the CDC, the Centers for Disease Control, it's ramping their resources up. So how are we helping in terms of their crisis? Microsoft has recently developed an assessment bot. So if you're considering using Azure technologies, AI technologies, to understand where your patients are coming from, or actually triage them, before they even come into your institutions, they already get some first-hand information from you. That's actually very useful in terms of considering your limited resources. So in terms of CDC, they have quickly set up a bot to go through the symptoms and risk factors for people worrying about their symptoms or where they are located and what sort of measures that they're taking. So if you go to CDC website today, the bot is available, so people can at least get some confirmation or information about COVID-19. Another case in the UK, NHS is also combating the disease, and they have implemented virtual visits. So similar to what we're doing with CHK Medical Center in terms of telemedicine, NHS has implemented virtual visit services based on Microsoft Teams. So to enable their clinicians are safe in an environment that they could also attend to patients' symptoms, and also to save up travel time, because time has become a very precious resources for them. Other than that, they're also using Dynamics 365 Remote Assist. So this is pretty new. If you have heard of HoloLens and you've heard of AR, VR technology, we actually have an application based on Microsoft Teams infrastructure that allow users on the field to access through HoloLens, whether it's AR, VR glasses, or through their mobile phones, to tap into the expert resources in the backend using Teams. So basically, when a field engineer or a field site clinician pull out their phone and dial up a call to connect to the expert can see real-time what's happening on site, and they can interact with 3D annotations. So in terms of high-cost maintenance, where there is a ventilator that has to be installed or repaired, this comes into place very handy, because the experts are actually also locked down at home or in their offices and they can't travel. So for the on-job training, Dynamics 365 Remote Assist comes into place. Another case study here is from China. So Chinese hospitals are also introducing Remote Assist to provide break-fix support to the equipment, because they want to protect the employee while they want to ensure that these high-cost equipment are up and running on the ground. And then later on, we have also seen a series of European healthcare institutions implementing emergency response solution. So this is a solution based on Microsoft Teams and Power Apps. So on the site, whether you're a nurse, you're a cleaning janitor, or you're a doctor, if you have anything that worth reporting on the spot instantly, you can just pull up your phone, tap into the appropriate form, and then plug in the data you want. For example, you want to report on a low stock of masks, or you want to report on how many cases that have been flagged emergent at the ER room. So the management level can instantly see the real-time data coming in and arrange the resources accordingly every day, or even near time. So this is a very mobile solution. There's also Power BI dashboard supported in the backend, and it really helps these healthcare providers to transform in terms of data synchronization and data democratization. So this is just a quick recap, and just to give you a little bit of ideas of how other global institutions are also transforming with the help of Microsoft technology. So without further ado, I'll pass back the time to Q&A, because I believe that you also have a lot of questions for our guests today. Thank you.
Lastly, Q&A will be hosted by Fred Xu, National Technology Officer at Microsoft.
Hi everyone. First of all, thanks for staying throughout the event until the very last session on Q&A. So before I start the Q&A session, I'd like to apologize for the big hiccup about an hour ago. Because if you're not in this room, if you're here, you probably see a lot of cameras, video, AV equipment, so a lot of point of failure here, so things happen. So sorry about that. So before I actually go into the Q&A, I know many people submitting your question through the online platforms. Actually, let me recap of what you actually hear today since this morning. So you hear from Keren talk about Microsoft, the newly announced the healthcare cloud platform just like 2 weeks ago. So that's very significant announcement from Microsoft. So Calvin, our public sector lead, talk about what Microsoft been doing in Hong Kong to support the local COVID-19 situations with some of the solutions that offer to market with our Empower Hong Kong program. And Deputy Commissioner Tony actually talked about the privacy concern or issue on all this technology that we are implementing to support the healthcare sector. I think the keyword I pick up is actually privacy by design, and actually should be built into everything you do when you delivering your digital platform in that industry. Dr. Fong shared their experience on implementing probably the very first telemedicine service to their customers or clients, patients in Hong Kong, and also saw some of the concern in the area of like whether the regulation policy supporting like a tele pharmacy delivering and so on. And Mandy and our partner Keith here and talk about their journey to actually bring this technology forward to support organization UMP to achieve their digital transformation journey to support their patient and service provider. And Nati actually talk about some of the example running on our Power Platform to support different like a healthcare organization to do like emergency response to tackle this COVID-19 events in the world. So I know there's some question coming in. Many of them actually good for Dr. Fong, actually, if you don't mind. So the first one I saw is actually say chronic disease actually are very common among the elder people. But when we actually introduced this telemedicine, telemed pharmacy, a lot of elder people that are not very familiar with our system of technology. How we actually resolve that issue, how we tackle that issue when you design your application?
Well, so far we don't have very old patients. Very old patients usually they go to the hospital authority.
Yeah,
so even for our patients, they're not that old. And so in terms of technology-wise, I think they're actually it's very easy for them to pick up. It's not a big problem. My view is that age is not a problem nowadays. Even like people of my age, I got white hair and all that. Yeah, I can pick up technology quite well. So I don't think age is a problem. As I said, even doctors themselves who are in active practice, some of them actually may not be very conversant with all this mobile technology or sort of cloud-based medical record and that sort of thing. And the penetration of like electronic health record among private practitioners in Hong Kong is still low. And because of this low penetration, they are not used to actually doing all this digitally or online. They still rely on paper record and that sort of thing. So I think that's actually a hurdle. But I think on an individual basis, it's not a matter of whether the person is technology competent or not. The issue is actually whether the technology match the need, the consultation need and all that. And even with telemedicine, as I mentioned earlier on, it's actually not. You cannot rely on it all the time. You cannot replace. You cannot have virtual physical examination. Physical examination is you have to touch the patient, watch the patient, and all that. You can't. That cannot be replaced. And so telemedicine cannot do everything. Most of the time, our patients are chronic patients who've been. We know the patient for a long time. We have a doctor-patient relationship for a long time. And the doctor knows the patient well, and the patient knows the doctor well, and it's a follow-up consultation. So most of the time, we are actually dealing with that sort of patients.
Yeah, also when we actually talk chit-chat before the event, I understand many patients, they don't even use a video conferencing feature. They just use a phone or voice features.
Yeah, it depends. As I said, it depends on the needs of the patient. Some they actually they are very comfortable with using video conferencing facilities. Some, they find it more convenient using a phone. But of course, phone is a problem for us because you have to have a record. Although this is called telemedicine, teleconsultation. It's a consultation. At the end of the day, it has to the record of consultation has to be put into the medical record. You see, and that's a problem with just rely on telephone alone. Yeah, because you can't have a record, unless the doctor, after the telephone consultation write down something, but you can't have it, right? So and that's a problem. So I think on the whole there's a limitation. The telephone simple, and everybody knows how to use it, that type of technology, but you can't. There's more limitation with it. Yeah. So we have to aware, when to use what technology as well.
Yeah, I think the second question I probably throw to Mandy. I know digital transformation or adopting technology in hospital been around for a long time, but still there are many doctors, they really hesitate to use technology, right? Especially telemedicine, right? So do you see this still a issue with the doctors in your organizations?
I think actually, doctors, the most important thing in the doctor side is to give proper consultation to their patients, right? So in whatever form, it should be the target or they want to achieve. So telemedicine is one of the way, one of the technology to let the doctor to give consultation to the patients. Like Dr. Fong said, VC, virtual care, is not in anyhow to replace physical consultation, right? It is just another way to provide to the patients or doctors to give proper consultation to the patients. So, of course, we have to overcome some hurdles when my organization to convince doctors to use telemedicine, like the regulation part, or the technology part is just a small thing to my extent, because doctors, yes, they may not familiar to use technology, the mobile things, but in our design of the technology or the apps, we are trying very much to help them to use them easier. So they are just click in one go, and then they can start the consultation. So I think it is it takes a process to cultivate, to educate, or to convince the private doctors to use more telemedicine service.
Okay, good. Yeah, I saw there are many questions coming in. There's one coming in. Let me see if I read that, okay? Will it consider to put portable devices, okay, at the patient's home for remote monitoring, also let patient to have choice to stay in a hospital or at home? For example, the elderly service center. So will like a healthcare service provider to offer device to put their patients home to help them to give them choices to stay at home or in the hospital?
I think this is doable. Nowadays, you don't really need to. Sometimes you may not really need to give the patient the device, and of course we have a lot of wearables, sensors, and that could actually help to provide the physiological data for the patients for telemonitoring. Now, so technically this can be done, and now it's actually whether it's done or not. It's actually depend on a lot of things as well, because like when it comes to patient data, we don't want to keep the data in portable device because it could be lost. So we prefer to have it in the cloud or somewhere where there's a secure environment. Yeah, and so that requires a whole sort of a system infrastructure. And I think at the present moment, the limitation, the constraint is that, especially in the private sector, it's actually this sort of infrastructure is actually not that readily available. I think a lot of private hospitals actually do not have their technology up to that level. Now in Hong Kong, in public hospitals, they do have that capability because it's actually, in terms of the IT infrastructure, it's actually much more advanced than in the private side. You see, but they have a different type of patients. Their patients are really old. So different challenge.
Got it. Okay, so I think we have time for one more question. So maybe I'll give the question to Keith. So what's the next disruptive healthcare technology that you foresee, like after all this telemedicine, like e-health record, like wearable device, contact tracing. So what's the next big thing?
I think that's this is exactly, before I joined this section,
Yep.
actually we walk around your 5G center. I think that this is one of the bigger, from my perspective, is a kind of one of the breakthrough for that, as what Dr. Fung mentioned, that right now all the infrastructure and etc. Like for example, if we have some of the movement detection for the elderly at home and etc., we have to have some of the what we call is the network to provide a kind of the data to submit to the cloud or the another safer place. So that at the same time that we have knowledge, their family doctor or their specialists to help them or to doing some of the medicine and etc. etc. This is exactly what we are talking about as well, because we are quite impressed when we saw some of the partner that's already doing some of the movement detection for the elderly. So that's for the private hospital perspective or the family doctor perspective, so that they will know about the accident or the instant immediacy.
Sure, great. Thanks for the great answer. So with that, I would like to conclude our event. I probably don't need this. I rather show off my, it's not really another brand stuff. It's more like a Microsoft device. I just take off the thing. I want to write thank you, big thank you, how you see that, to all the healthcare service providers and all the people involved in this industry during the last few months for your hard work. Appreciation from Microsoft Hong Kong. Thank you very much. Thank you.
Thank you.
Thank you.
Thank you for staying with us today, and we hope to see you soon again virtually in other events, and hopefully very soon in person. Thank you and have a nice day.